With approximately 500,000 new cases of peptic ulcer disease diagnosed each year in the United States, stomach ulcers are far more common than most people realise. Yet here's the concerning truth. Many people ignore the early warning signs, dismissing them as simple indigestion or stress-related stomach pain, only to discover later that they've been living with a serious condition that could have been treated much sooner. Today we're going to explore the subtle early signs of stomach ulcers that most people overlook, understand what causes them, and learn when it's time to take action. This information is for educational purposes and not medical advice. Consult a healthcare professional before making any changes to your diet, exercise or supplement routine. Results may vary. Before we dive in, make sure to hit that subscribe button and ring the bell for notifications, because I share health tips like this every week that could change your life. Understanding stomach ulcers, the basics. Before we dive into the early warning signs, let's understand what we're dealing with. A stomach ulcer occurs when stomach acid eats through your protective stomach lining, producing an open sore. Think of your stomach lining like the protective coating inside a cooking pot. When that coating gets damaged, the acid starts eating away at the metal underneath. Peptic ulcer disease causes open sores in your stomach lining or duodenum, the top of your small intestine, and these sores can range from small, superficial erosions to deep, crater-like wounds. The pain and symptoms you experience depend largely on the size, location and depth of these ulcers. What makes stomach ulcers particularly tricky is that they often develop gradually. Unlike a sudden injury, ulcers form over weeks or months, which means the early symptoms can be so mild that people adapt to them without realising something is wrong. In some cases, ulcers don't cause any symptoms at all, making early detection even more challenging. The two primary culprits behind most stomach ulcers are H. pylori bacteria or non-steroidal anti-inflammatory drugs, NSAIDs. About 2/3 of the world's population has H. pylori in their bodies. For most people it never causes any symptoms, but it's the most common cause of peptic ulcers. Meanwhile, about 30 to 40% of people in the United States get an H. pylori infection, though only about 10% to 15% of people with H. pylori get an ulcer. Early sign 1, persistent abdominal discomfort. The most common early sign of stomach ulcers is also the most easily dismissed: persistent abdominal discomfort. Abdominal pain is the most common symptom of a peptic ulcer. The pain may be dull or burning and may come and go over time. However, what makes this particularly concerning is how people rationalise this pain away. According to the United Kingdom's National Health Service, NHS, the most common symptom is a burning sensation or pain in the middle of your abdomen, between your chest and belly button. Typically the pain is more intense when the stomach is empty and can last for a few minutes to several hours. The key distinguishing feature of ulcer pain is its timing. For some people, the pain may occur when the stomach is empty or at night, and it may go away for a short time after they eat. For other people, eating may make the pain worse. This creates a confusing pattern where you might feel better after eating one day and worse the next. What people often ignore is the persistence of this discomfort. Unlike typical indigestion that comes and goes with specific foods or situations, ulcer pain tends to follow patterns and persists over days or weeks. A dull, burning pain is the most common sign of an ulcer. You usually feel it between your belly button and breastbone. The pain may spread to your back, but the pain isn't always consistent. Have you been experiencing persistent stomach discomfort that comes and goes? Let us know in the comments how long you've been dealing with unexplained abdominal pain. Your experience might help others recognise their own symptoms. Early sign 2, changes in hunger and appetite patterns. One of the most overlooked early signs of stomach ulcers is changes in your hunger and appetite patterns. Many people notice they're feeling full more quickly than usual, or their normal eating patterns have shifted without any obvious reason. Feeling full easily is a common early symptom that people often attribute to aging, stress, or changes in activity level. However, when an ulcer is developing, inflammation in the stomach can affect how your stomach stretches and accommodates food, leading to premature satiety. Some people experience the opposite problem. They find themselves getting hungrier than normal, especially between meals or at night. This happens because the stomach produces more acid to try to heal the damaged area, and this excess acid can trigger hunger sensations even when you don't actually need food. Another pattern that emerges is what doctors call food-responsive pain. Some people discover that eating temporarily relieves their discomfort, leading them to eat more frequently in small amounts. Others find that certain foods that never bothered them before suddenly cause discomfort or make their symptoms worse. The timing of hunger can also shift dramatically. You might find yourself waking up hungry in the middle of the night, or experiencing intense hunger pangs at unusual times of day. This happens because the pain may occur when the stomach is empty or at night, and your body learns to associate eating with pain relief. Early sign 3, subtle digestive changes. Beyond obvious stomach pain, stomach ulcers often announce themselves through subtle digestive changes that people easily dismiss as unrelated issues. Stomach ulcers aren't always painful, and some people may experience other symptoms such as indigestion, heartburn and acid reflux, and feeling sick. Increased belching and bloating are common early signs that many people attribute to eating too quickly or consuming certain foods. However, when an ulcer is developing, the stomach's normal digestive processes become disrupted, leading to increased gas production and slower gastric emptying. The pain can be accompanied by bloating, belching, nausea, and heartburn. What makes these symptoms particularly concerning is when they occur consistently. Regardless of what you've eaten or how quickly you've consumed your meal, changes in your response to antacids can be another early warning sign. You may have an ulcer if you experience burning stomach pain after eating fatty, acidic or spicy foods, and if over-the-counter antacids or acid blockers temporarily relieve the pain. If you find yourself reaching for antacids more frequently than usual, or if they provide only temporary relief before symptoms return, this could indicate developing ulcer disease. Nausea, particularly in the morning or between meals, is another subtle sign that people often overlook. This nausea might not be severe enough to cause vomiting, but it can create a general sense of unease or queasiness that affects your daily life. Early sign 4, sleep and energy disruptions. One of the most under-recognised early signs of stomach ulcers involves disruptions to sleep and energy levels. Stomach pain that may feel worse when the stomach is empty often manifests most prominently at night when your stomach has been empty for several hours. Many people report waking up between 2 and 4 a.m. with stomach discomfort, but they don't connect this to potential ulcer development. Instead, they blame stress, aging, or other factors. This nighttime pain occurs because stomach acid production continues even when you're sleeping, and without food to buffer the acid, it can irritate the developing ulcer more intensely. The sleep disruption creates a cascade of other problems. Poor sleep quality leads to increased stress hormones, which can actually worsen ulcer development and slow healing. You might notice that you're more tired during the day, less able to concentrate, or more irritable than usual. Some people also report changes in their energy levels related to eating. They might feel unusually tired after meals, or conversely, feel more energetic after eating if food temporarily relieves their discomfort. These energy fluctuations can be subtle but persistent, affecting work performance and daily activities. The connection between stomach ulcers and sleep problems is often missed because the symptoms can be mild and intermittent in the early stages. However, recognising this pattern can be crucial for early diagnosis and treatment. Early. Sign 5. Mood and stress response changes. Perhaps the most surprising early sign of stomach ulcers is changes in mood and stress response. The gut-brain connection is powerful, and developing ulcers can affect your emotional state in ways that seem completely unrelated to digestive health. Many people notice increased irritability, anxiety, or difficulty managing stress during the early stages of ulcer development. This happens because the chronic low-level inflammation and discomfort from a developing ulcer can activate your body's stress response systems, even when the physical symptoms are mild. The discomfort from early ulcer development can also affect your relationship with food and eating. Some people develop anxiety around mealtimes, especially if they've noticed that certain foods trigger symptoms. This can lead to restrictive eating patterns or food avoidance that impacts nutrition and social activities. Sleep disruption from nighttime symptoms compounds these mood changes. When you're not getting quality sleep due to periodic stomach discomfort, your emotional regulation suffers, making you more susceptible to stress and less resilient in handling daily challenges. Have you noticed changes in your mood or stress levels that seem to coincide with digestive issues? Share your experience below. Understanding these connections can help others recognise when it's time to seek medical attention. Red flags when early signs become serious. While we've focused on early, subtle signs, it's crucial to understand when symptoms require immediate medical attention. You should visit your GP if you think you may have a stomach ulcer, but certain symptoms indicate a medical emergency. You are vomiting blood. The blood can appear bright red or have a dark coffee ground appearance. This indicates bleeding from the ulcer site and requires immediate emergency care. Similarly, dark tarry stools can indicate internal bleeding and should never be ignored. Severe, sudden abdominal pain that's different from your usual discomfort, especially if accompanied by fever, rapid heartbeat or dizziness, could indicate ulcer complications like perforation or obstruction. These are life-threatening conditions that require emergency surgery. Progressive weight loss, even when you're trying to maintain your normal eating patterns, can indicate that an ulcer is interfering significantly with your nutrition absorption, or that you're unconsciously avoiding food due to pain. Persistent vomiting that prevents you from keeping food or liquids down for more than a day requires medical attention, as it can lead to dehydration and electrolyte imbalances, while also preventing ulcer healing. The importance of early recognition and treatment. Understanding these early signs matters because stomach ulcers are highly treatable when caught early. Ulcers heal when the conditions causing them go away, and modern treatment approaches can effectively address both H. pylori infections and NSAID-related ulcers. Early treatment prevents complications like bleeding, perforation, or obstruction that can be life-threatening. It also prevents the chronic pain and digestive issues that can significantly impact quality of life when ulcers are left untreated. The diagnostic process has become much more sophisticated and less invasive than in the past. Simple blood tests can detect H. pylori infections, and when necessary, endoscopic procedures can provide definitive diagnosis while being minimally uncomfortable for patients. Treatment typically involves a combination of medications to reduce stomach acid production and, if H. pylori is present, antibiotics to eliminate the bacteria. Most people experience significant improvement within days to weeks of starting appropriate treatment. The key to early recognition is paying attention to patterns rather than isolated incidents. When multiple subtle symptoms persist over weeks, especially when they occur in the characteristic patterns we've discussed, it's time to take them seriously and seek medical evaluation. Remember, stomach ulcers are incredibly treatable when caught early. By recognising these early signs and taking appropriate action, you can prevent a minor problem from becoming a major health issue. Your body is constantly communicating with you. The question is whether you're listening to what it's trying to tell you.